What is implantation bleeding, or is your spotting possibly a sign of you being pregnant? Hi friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. I'm a fertility doctor, and I want to break down just some basics about a question I'm asked all the time, which is, I'm having spotting. Could this mean I'm pregnant? And this brings up an honest thing, which is called implantation bleeding or implantation spotting. So we're going to review quickly what it is and what else it could be if it is not, and when you should be worried. This channel exists so that you can learn more about your fertility. Would love it if you would subscribe and share, ask a comment, but stick around so that we can spread more knowledge about women's health. So first of all, it's really important to understand, when does implantation occur? And this just goes back to this crazy nomenclature about how far along you are pregnant when you get a positive test and what's actually happening in your body. Let's remember that at the start of a cycle, you have a group of eggs that comes out of the vault inside the ovary. From this group, one egg is going to be stimulated to grow by follicle stimulating hormone, or FSH. And this is a well-named hormone because each egg grows in a follicle, and as it gets bigger, the follicle gets bigger. So the egg is maturing, follicle is getting bigger, and then you're going to ovulate that follicle and the egg will be released, typically around midpoint in the cycle. The honest answer is that your cycle is divided into the follicular phase and the luteal phase. And the luteal phase lasts about 12 to 14 days. The follicular phase can vary. So people who have cycles that are 24 days in length, they are ovulating closer to day 10 to 12. And somebody who has a cycle length that is 30 days is ovulating later in the cycle because they are ovulating day 16 to 18. So you don't always ovulate on cycle day 14 like you might see in graphs, because graphs are normalizing the 28-day cycle. But in general, you're going to grow an egg, and that's called the follicular phase, length of which can vary person to person, should be relatively consistent for you. Once that egg is released with ovulation, you might feel this. That can actually be a cramping pain called Mittelschmerz, which is German for middle, so the middle of the cycle. You might notice egg white cervical mucus. That's a type 4 cervical mucus caused by those really high estrogen levels. You might notice a positive on an ovulation predictor kit, which is an OPK test that you urinate on, and it's detecting the LH surge, and it's positive the day before you ovulate. You might be using a trigger shot, which is typically the day before you ovulate, or you might even notice a temporize a few days later. But regardless, after you ovulate, that follicle is going to reform and become the corpus luteum. And this is just so fascinating, but that corpus luteum is now going to be stimulated to make progesterone from pulses from the brain. So first half of the cycle, the follicular phase, growing an egg, estrogen only, you are not pregnant yet. Ovulate, we'll just say around the midpoint of the cycle. And then the second half, typically 12 to 14 days, is the luteal phase. And this is where there is a corpus luteum making progesterone. And there's estrogen too, so estrogen and progesterone. When that egg is released, it has 24 hours to be fertilized. So this is always very interesting because this is what's determining your fertile window, because the egg has 24 hours, the sperm lives around for 5 days. So that fertile window is the 5 days ending on the day of ovulation. After that, if the egg is fertilized, that early embryo growth, it all happens in the fallopian tube. So egg and sperm meet, fertilization occurs in the fallopian tube, that little embryo is growing and developing throughout the course of the tube until it's reaching into the uterus, of which now if you're going to get pregnant, this is when implantation is going to occur. The soonest implantation is going to occur is 5 days after ovulation. So if we think of ovulation of day 0, then you have day 1, 2, 3, 4, 5. That will be the soonest. The average time most people are going to tell you is 5 to 7. You'll see loosely 5 to 9 because people don't always know with precision when they ovulate. But that embryo is entering into the uterus, and it actually does need to implant relatively soon. Now, it is rare yet not impossible to get a pregnancy test at this point. So when people are trying to test for pregnancy really early, the embryo's got to get some of its hormone, which is HCG, into your bloodstream, and that's what you test on the pregnancy test. So if we imagine this little embryo has come through the tube, is arriving in the uterus, and now you have this uterine wall. Your uterine wall has got this fluffy endometrial layer, and then it's got other layers of normal uterine vasculature. This embryo is first going to stick to the uterine wall, and then it's going to start to release enzymes to eat away at the wall of that uterus until it can invade into that uterine vasculature, and that's what becomes the placenta. This process is so fascinating that the body recognizes this as an allograft, meaning it's not your body, but it's not totally foreign, and we're going to not reject it all the way and allow this to implant completely. That's fascinating. That being said, the first step of this was enzymes to eat away at the wall of the uterus and eat away at some of those blood vessels. And so this can cause cramping because that can be a painful process. It can also cause bleeding or implantation spotting. Now, this is generally going to happen before you would expect your period, although it can happen at the time of your expected period too. But most people who are going to experience it in what we consider that last week of your period cycle, the second half of the luteal phase, and the soonest you would anticipate seeing it would be about 5 to 7 days after ovulation. About 25% of people actually have implantation spotting or bleeding, so that's not a small number. So in general, implantation bleeding is very light. It is spotting. You don't necessarily need a tampon or a pad. You might just notice it when wiping. It is not going to be clotty or very heavy or the level of a period. So it's definitely distinguished because it's not a true shutting of the lining. It's typically an opening up of the blood vessels. Some people even will say it's like light pink because it gets mixed with some of those cervical or vaginal secretions and is very light, not that dark red bleeding. Cramping also can be very common. Once that embryo really starts to implant in, what is happening is it's making HCG. And this is so important because that HCG is one, how a good embryo is telling the body that it's good. That HCG is going to start to exponentially rise and double every couple of days. And that HCG is going to stimulate the corpus luteum to keep living past that 12 to 14 day lifespan. So whereas normally it's getting stimulated from the brain with these pulses of LH and pulses rising and falling of progesterone, once that pregnancy comes and now you have a constant and exponentially rising exposure to HCG, suddenly now progesterone production from the corpus luteum is going to kick up. So you also start to notice a lot of the increased progesterone symptoms. So around the implantation time, this can be fatigue, nausea, dizziness or lightheadedness. You can notice a sensitivity to smell, food aversions, breast tenderness. And so all of these extra high progesterone signs might be increasing. You might have some cramping or spotting. I will so often have somebody call the clinic, I'm spotting, it didn't work. And we always know if we do fertility treatments, we're going to check a pregnancy test because implantation, bleeding, or spotting can be common, and it doesn't mean that it's your period coming. Importantly, generally that HCG level's not high enough to detect on a home pregnancy test until you get closer to that missed period interval. When you would miss your period, let's say that's 2 weeks after ovulation, at that time period, you are now 4 weeks pregnant, which is so bizarre because 2 weeks ago you were just ovulating and you didn't even have an embryo implanted until you were 2 weeks and 5 days pregnant at the earliest. So we were really just a few weeks pregnant, a tiny little bit pregnant. But because we didn't know when implantation happened and we didn't know exactly when you ovulated or exactly when this embryo development process was, way back when, the only sign we knew about how pregnant you were was when your last period was. So that's why doctors will be asking you when was the first day of your last period when they're trying to determine your due date or your gestational age. And super important that if you're doing fertility treatment, if you have irregular or long cycles or short cycles, or if you know when you ovulated because you're tracking, that is a much more sensitive indicator than your last period, and definitely tell your doctor this. All right, so again, typically implantation bleeding is very short. It is light like spotting. It can be light pink, it could be light red, light brown, but it's not heavy in nature like a period. It's not lasting a super long time, often associated with other high progesterone signs and symptoms that will be going away if you're getting a period. And let's say you have some of this, mid-cycle spotting and you're not pregnant and it's consistent. One, if it's not consistent, everybody's entitled to a weird cycle. Two, if it is coming, then we're starting to be worried. Could there be anything inside the uterus, like a fibroid or a polyp? Could there be hormonal issues, which is maybe making that luteal phase less robust, like thyroid or prolactin? Could you be potentially starting to have a really low egg count, and that could be impacting your ovulation? So if you are consistently seeing luteal bleeding or spotting and you're not pregnant, that is definitely something we want to get evaluated to make sure we know what's going on. As always, I hope this video helped you learn a little bit more about implantation and bleeding. You can follow along on Instagram at Natalie Crawford MD or listen to the As a Woman podcast. Thanks, friends.